principles of dermatological therapy. So basically, it means that in dermatological diseases, what should we do to give treatment to the patient? Sorry, we know that in disease like pneumonia or even heart problem, the principle of management probably will be like oral medication or IV medication. But for dermatological diseases, because it's a skin disease, I think the main point of the therapy is still topical therapy. So what is topical therapy? Topical therapy is topical medication is one that is applied to your body surfaces such as a skin or mucous membrane. The advantage of topical therapy will be it helps to achieve high concentration of the drug in the skin and minimal exposure to other organs so that it minimizes the systemic side effect. Okay. So revise a bit regarding last week's layer of the epidermis. We know that we have 5 layers of the epidermis: stratum corneum, lucidum, granulosum, spinosum, and also basal. So corneum is a rate limiting barrier to percutaneous drug delivery. The drug penetration is inversely proportionate to the thickness of the stratum corneum. Basically, the thicker it is, the less likely the drug is going to penetrate your skin. This is like logical thinking lah. So regional differences in penetration in decreasing order will be the site that the topical medication most likely to penetrate will be mucous membrane, your scrotum, and your eyelids. So in this area, you have to be very careful when you use the topical medication. You cannot use those with very high concentration because the absorption will be very, very strong. That's why you see a lot of even facial products, they will have separate products for your eyelids because in the eyelids region, the absorption is very strong. Okay. Then face, chest, and back, upper arm, legs, lower arm, legs, and of course the dorsum of the hands and feet. These are the area where the skin is the thickest, and you need very, very, very oily medication for the medication to penetrate the skin layer, the stratum corneum basically. Okay. So in this slide, maybe your exam will ask which is the most important layer in the epidermis. There is a rate limiting barrier to percutaneous drug delivery. Okay, so you need to remember the outer layer's name is stratum corneum. Okay, so again, this is a graph that shows regional variation in the percutaneous penetration of hydrocortisone in men. The highest place where the penetration will be your scrotum and also your eyelid, followed by jaw, ankle, forehead, axilla, scalp, back. So basically, logical thinking now, the thicker the area, the less likely the corticosteroid will going to penetrate the skin. The thickest area will be the sole of your foot. Okay. So how is the medication going to penetrate to your skin? Okay, there are 3 ways how the medication is going to absorb into your body, into your skin layer. Number 1 is through transcellular penetration, which is across a cell. Number 2 is intercellular penetration between the cell, and also trans-appendageous penetration. Remember last week we talked about the skin appendages. There's 5 skin appendages, right? I asked you to memorize. All right. Then what are the different type of topical medication? So IV medication, you have your IV antibiotics, IV fluids, you have your IV proton pump inhibitor. There's a lot of different classification of the drugs in your pharmacological. So for topical medication, there are basically 5 main drugs that you need to know. Topical antibiotics, topical antifungal, topical steroids, corticosteroids, which is very commonly used, topical antiviral, and also your moisturizer or emollients. Okay, so these 5 is very important and also very easy to remember lah. So basically, skin is quite easy, right? Because there's only 5 medication that you can use, and most of the time, there's only 5 medication that you use interchangeably lah. Okay, if you treat the fungal not improving, you treat antibiotic not improving, you use steroids. Not as simple as that, but this is the summary of it now. Okay, so how do you prescribe a topical medication? So sometimes you see a patient who went to see a dermatologist, the prescription of the medications, a lot of weird numbers and also short form. Sometimes you don't know what the dermatologist is writing about. Okay, so basically in the prescription, the dermatologist should include the vehicle of the formulation. We'll talk about what is all these things now. Concentration of the drugs, the frequency of the applications, the quantity to be used, the set of the applications, and also precise timing of application. This one you don't have to memorize. It's okay. You don't have to memorize. Okay. So knowing about the medication, we must also know what is occlusions. So occlusions is something that will increase, basically is increase the absorption of the medication to our body. So sometimes after you apply cream to, let's say example, your hand, after that you go and do some work, you wash hand, you do work, then the cream will somehow wear off. So occlusion is something that will help to to keep the medication, to keep the topical ointment, topical medication stay put in your skin, in the certain area of your skin, so that the absorption can be maximized. So example of occlusion will be gloves, plastic wrap, cotton gloves, or even socks. Benefit is increase your hydration, temperature, and prevents a wash off. Okay, so it increase the efficacy as well as side effect as well. So besides increasing the efficacy, side effect is a thing that we must remember. Whether this type of medication is it suitable to give an occlusion. Let's say this is a very high intensity, very high concentration steroids. Should we really use occlusion? Will it increase the systemic side effect? So these are the questions you have to ask yourself before you're prescribing an occlusion to the patient. Okay. To derive the greatest benefit from the occlusion, patients should hydrate the skin by immerse in the water for approximately 5 minutes before the application. With many drugs, occlusions increase the drug delivery by 10 to 100 times the amount of drug delivered when not occluded. That's how your systemic side effect will be intensified as well. Besides the efficacy better lah, okay. Next, we'll talk about the concentration of the drugs. So most of the time we see the dermatologists, they prescribe as a liquid paraffin. They'll say W stroke W, W stroke V. So basically this is the weight of the formulation. You don't really have to memorize this. You don't have to remember this slide. Don't have to remember. Wait. So basically it just tells us that 1% of the 1 gram of the drug in 100 gram of the formulation. Basically, is the formulation, how pharmacists make this medication, different concentration, like your steroid, different concentration, or even your liquid paraffin, your moisturizer emollient also, they have different concentration. Okay, so don't have to remember this. Frequency of the application. So logical thinking you prescribe medication, you must of course tell the patient how frequent you need to apply this medication. Can you apply this medication 4 times a day or even 2 times a day? Be specific, okay, to maximize the response and avoiding side effects. Excessive can result in irritation, systemic exposure to drugs, and also unwanted side effect. Active preparations are usually given once or twice a day. Most of the time, we only use medication like twice a day, twice a day. Usually, if it's a medicated medications, it's twice a day. Unless it is emollient. Emollient, usually the doctors will say you can apply as frequently as possible, especially in patients with very dry skin, eczema. You can apply the emollient many times in a day. But for medication like your antiviral, antibiotics, or steroids medications, okay, antifungal, you have a specific time and also frequency on how many times you should apply. So quantity to be applied. Usually the dermatologist will prescribe the unit as a fingertip unit, basically rule of hand, your rule of the hand. You look at your hand, basically the small tip, all right, the small distal part of your fingers. This is a 1 fingertip unit, okay. This is equal to the quantity of ointment extruded from the tube with a nozzle of 5 mm diameter extending from distal crease to the forefinger to ventral aspect of the fingertip. So basically, it is about 0.5 gram in male and about roughly is a 0.5 gram to be specific is 0.49 in male and 0.43 in female, but roughly it's about 0.5 gram Rarely we go and measure it, but generally it's just cover the whole fingertip of it and most of the time I think all of us who have used topical medication before, we know that we usually use as much as possible to cover the area that we want to apply correct. So even though the prescription is a fingertip unit, but this is rarely followed but we should follow by right okay. So vehicle is the constitution of the formulation apart from the active ingredient. So something the medication must be carried out by a vehicle, right? 1 minute. Okay. of the medication. Okay, so our constitution of the medication formulation must be brought about by a vehicle. So the vehicle brought the active ingredient of the medication. So the ideal vehicle base should be non-toxic, non-allergic, non-irritant, stable, chemically inert, cosmetically acceptable, and should not inactivate the drugs. So basically, the safest medication should not have any smell, should not have any alcohol, toxic ingredient that can irritate your skin. Okay, so non-specific beneficial therapeutic effect like occlusion, hydration, cooling, soothing, astringent action. These are the extra benefit of the vehicle that can give us that. Okay, so examples of the vehicles will be ointment, cream, gel, lotion, paste, powder. So these are the example of the vehicles. We'll talk about this in details. I'm sure you have heard of it, right? Some medications is labeled as ointment. Some medication labeled as cream, gel, lotion, paste. So what are the difference? Are they actually the same? They are not the same now, okay? Yeah. So if you look at the this picture on the left hand side, you will see that cream base and ointment, these are actually very different in terms of consistency. Ointment is like more gel like and very oily. The medication actually the gel the ointment actually stick together and will not easily come off lah. While the cream type of medication, cream type of topical medication, uh once you open the cap, the medication will flow out easily. It's more liquidy, but it's not as liquid as lotion, okay, or foam, but it's more liquid compared to ointment. So vehicle sequence of potency, maximum potency will be your ointment. No, ointment is very oily, followed by your cream. Cream is more the consistency is thicker than your lotion. Lotion is very watery. I'm sure most of you have used lotion before, right? Your moisturizer is very oily one, right? Okay. Some sunblock are quite uh, watery, so they are like lotion in consistency, and some sunblock, while some is quite thick, but most of the sunblock are lotion in consistency. Okay. Then followed by your gel, your spray, and your foam. Foam will be like the minimal potency. Alright. Then what is ointment? So ointment is actually semi-solid petroleum-based vehicles capable of providing occlusions, hydration, and also lubrications. The advantage is they provide the best occlusion, good hydration, can be used in chronic condition, chronic dry skin, lichenified dermatosis. Okay, this is the most potent effect of the drugs. Fewer preservatives are required as they contain less water and they do not sustain microorganisms. So usually when you use ointment, it's not very comfortable to use because it's very sticky, very sticky. After you apply your hand, your the skin area feel very sticky. Alright, but this is important for very dry skin or very thick skin condition. Last week we learned about different type of skin lesions at the description. Remember lichenified dermatosis, which is very thick skin condition like plaque like that. Okay, so very dry, chronic, thick skin lesions. Okay, you use ointment. The disadvantage is difficult to spread and wash because it's very sticky, very oily. It will adhere to the skin that causes stickiness, and it decreases the evaporation and also heat loss, and cannot be used in acute weeping lesions and or your trigenous area. So the key word here is used in very chronic dry lesions, dry lichenified dermatosis. Okay, so because of all these characteristics, all these disadvantages actually advantageous to the dry chronic skin. Okay, so ointment base can be classified again into your hydrocarbon base, absorption base, emulsion of water in oil, emulsion of oil in water, and water soluble bases. Okay, all these are not important. Don't have to remember all these things. Okay, unless you're very interested in dermatology and you want to go and look at your products tonight lah. You see what are the ointments, what is actually the ointment, and what is the ingredient. Okay, so lotion is basically very oily. I'm sure most of you have seen or used calamine lotion, right? Have you used calamine lotion before? Yes or no?
Yes.
Yes.
So what is the effect of using calamine lotion? What do you feel? What does your skin feel after you use calamine lotion?
Soothing.
Yes, you can feel a very cooling, soothing effect, right? So actually, I think most of the time when you have chicken pox or any skin lesions, the doctors actually prescribe calamine lotion. But calamine lotion actually is not really suitable to use in this condition because it will make your skin very dry. After you use, you realize that your skin very dry one, like cracking things. The surface is like cracking one, but it's very soothing lah. So lotion is a very watery suspension. It have a drying and very cooling effect. So we don't use this in very dry skin because it can actually dry up the skin. Okay, useful for scalp and hairy area, and it spread over wide area easily because it's like watery, like not like ointment, very difficult to spread it. Okay, cosmetically it's more acceptable because it's not so sticky. Okay, so cream base, okay, like your aqueous cream or any moisturizer that's cream based is a water based product as well, but it's slightly thicker than your lotion. Lotion is very watery, but cream actually stay put one, it won't flow out one. Okay, again, it have a cooling and emollient effect. It also help to dry out moist lesion, and it help to hydrate dry scaly lesions. So this is like in between for lesion that is not too dry and also not too wet. Okay, it contains preservatives to prevent bacteria and also fungal growth, but it may cause allergy. So most of the time, government hospital based cream will be your aqueous cream lor, as the cheapest cream. But for me, I think this is the best cream to use. You can go and spend your money to buy all other expensive cream and emollient. Nowadays, many brands you can buy CeraVe, Cetaphil, Eucerin, and all these things. For me, I think the best cream for moisturizing, if you have eczema or things or any dry skin condition, dermatitis, the aqueous cream is the best from the hospital one. Yeah, it's no, it's not scented, no Dettol, no alcohol, so it's very actually skin friendly lah. Yeah. So ointment, we talk about ointment just now, but this is just to show you what is ointment like. Very, very thick and very, very oily. They have little or no water and contain no preservative. Okay, and it's less likely to cause allergic contact dermatitis. Oil-based products provide an occlusive layer over the skin surface that help to retain water. It hydrates the skin and just to remind, ointment is only useful for very dry, scaly, or lichenified skin. Okay, basically very very dry lah. Okay, so you see after you use ointment, the face is so oily. The whole face is so oily. Unless your face is very dry lah. So this patient face doesn't look very dry So if you put ointment, then it's too oily. More potent than creams and lotion is have a very greasy feels. Okay, cosmetically it's not elegant. Okay, you cannot go out like that. Okay, and then it may be used at bedtime because nobody looking at your skin at bedtime. Okay, it may occlude hair follicles and increase potency by putting under occlusion. What does that mean is after you put a medication, you can put an ointment on top of it. So to sort of like to occlude it as an occlusion to increase the potency of the underlying medication. So gel evaporate quickly, cosmetically elegant, like your hair gel. Yeah, useful for most skin conditions, especially the hairy area. Paste is I think all of you have used paste, right? Dental student, that oral paste. Okay, have you used paste before? Contains silicones that act as water repellent. Is very difficult to remove because in the it's a mucosa, like your mucous membrane. Usually mucous membrane is already quite wet. If you put something like watery solution, watery vehicles, the things cannot stick. So you need something that is difficult to remove, like your paste for the medication to stick on the area in the mucous membrane. Okay. Powder, I'm sure all of you know what's powder, baby powder. Okay, have a drying effect, used for body folds area, very useful for very body folds area. Okay, then you have to choose the correct vehicles for the type of wound. Okay, very very dry wound, we use ointment, or you want the medication to stick there one, you use paste. Alright, while very very wet wound or exudative wound, you use things like lotion, shampoo, powder. In between, have some excoriation, but it's not too wet, you can use cream or gel. Alright, so choosing a correct vehicle is very important for wound healing. So choice of preparation depends on the product, disease, and also patient condition of the skin. In acutely inflamed, red, swollen, vasculating, or also oozing dermatosis, you use wet dressings like lotions. Okay. Then in subacute chronic, less inflamed, less red one, you use lotion, paste, and cream. Very dry skin, you use ointment or paste. Generalized widespread eruption, you use lotions, cream, and also baths. bath is like your potassium permanganate baths, like you soak the whole thing inside one. You know, some wounds that's very wet and always come some water, always a serious discharge always coming out one. Those wound we actually use KMNO for bath. What do we mean by that is that as a solution very strong one. We advise patient to bring a bowlie to the hospital sometimes or even at home. Then you fill up the pail and then you drop a few drops only of the medication. Okay, then you soak the whole leg inside for 10 minutes, then you take it out and dry it. You will try to dry up the wet wound very fast one. So from this list, you can see that ointment is quite well, lotion is quite well tolerated one. From very wet wound to very dry wound to chronic subacute, chronic, also you can use lotion, okay? You can use lotion for dry, scaly, thickened wound as well, but just that the efficiency is not so good lah. Okay, but if you use this ointment for very wet wound, then basically totally it cannot heal. The whole thing is wrong lah. But basically, lotion is quite well tolerated for any kind of wound. All right. So avoid alright, hairy scalp area, avoid sheep lotion, non-water washable ointment or paste because you want to wash it away. External ear canal, sheep lotion paste to avoid it because difficult to clean it. Face, avoid anything that contain alcohol, menthol, alright. Your strong keratolytics or antralins, alright. The axilla, avoid any macerating greases. Pubic areas, sheep lotions. Intertriginous area, avoid ointment or paste because it will feel very uncomfortable. Usually this area we use powder, alright? Basically skin fold area. So local toxicity of the topical drugs, most common is the allergic and irritant contact dermatitis. Other will include your phototoxic, photoallergic reaction and also induction of acne. Irritants reaction can be minimized by applying treatment at the optimal concentration and treatment intervals and by selection of the correct vehicle. Sensitizations is more difficult to anticipate and to prevent as almost any component may sensitize. Malignancies is very rare. So basically local toxicity of topical drugs is very rare lah. The most common will be your contact dermatitis only. I'm sure most of you have cases of using different facial product that is not suitable for you. You get very irritated. Your face get very inflamed, irritated. Okay, because of this product. So this is called contact dermatitis. That you're in contact with a new products, or sometimes even hand lotion can cause contact dermatitis. But other than this localized reactions for systemic for other more serious local toxicity is quite rare lah. Alright. Phototoxicity, contact dermatitis is a common one. Other than that, it's rare, and the usual treatment will be you just stop using it and then it will get better already now. Okay. So systemic side effects is also rare. End organ toxicity like your CNS, central nervous system, your cardiac, your renal, teratogenicity, and drug interactions, type 1 hypersensitivity reactions, hypothalamic pituitary adrenal axis suppressions and malignancies. All these are very rare lah. Okay, so the systemic and topical side effect of most topical ointment, most topical medication, usually these are not the thing that will come out in the exam lah, but you should pay attention to your corticosteroid. Later we'll talk about that. That will come out in the exam. All right. So nowadays, just now we mentioned the 5 most important topical medication, right? Not sure whether you still remember. You have your antibacterial, antifungal, antiviral, your corticosteroids, and also your emollient. So most of the time now, you have a lot of combination medications in the market, okay? So when the doctor's selling you a cream, they must have a proper labeling. You shouldn't go to any clinic who just sells you a tube of cream without any label and then they mix themselves. You do not know what is the ingredient one. So you should stop going to see this kind of doctor, okay? You should go to a proper doctors who give you a cream or any topical medication with proper labeling so that you know what are you taking, all right? So nowadays, there's a lot of combination medication, especially combination with corticosteroids medication, all right? So widely in treatment of suspected infection and eczema in patients of all ages, typically consists of antifungal, antibacterial with a moderate to high potency topical corticosteroid. Such combinations have the advantages of providing immediate systemic relief because of the anti-inflammatory effect of the corticosteroid. The commonest medication that you see in this group will be your fusicort. No, have you heard of fusicort?
Yes.
Yeah, so fusicort will be your fusidic acid plus your corticosteroids. Very useful if you get Charlie, but you put the fusicort, then you get better very fast. Of course, if it's not improving, you should go and see a dermatologist to get some systemic antibiotics. If you get secondary bacterial infection, right? You heard of Charlie bite, right? You know what's Charlie, right? Your rose beetle. Quite common in Butterworth, huh? Alright, be careful. I'm not sure whether the area your near your college maybe don't have lah, but in Penang, basically in Semenanjung also quite common lah, rose beetle. Have you seen rose beetle before? Never ah.
Have seen.
Seen right? The small inside the tail is orange color, right? Don't go and kill it with your finger, Use a tissue paper and kill it, okay? If not, if your skin also can get contact dermatitis or some evident dermatitis on, alright? Alright, so we mentioned about the topical antibiotic, topical antifungal, emollient. One missing is topical antiviral and also topical corticosteroids. So now we want to talk more about topical corticosteroids and friends. So what is friends? Friends will be like your topical tacrolimus or things like that lah, right? So we talk about topical steroids first. This slide is very important. You know when you go to pharmacies or when you go to see a doctors, they will give you different strength of steroid medication, right? I think the most commonest steroid medication that doctors prescribe will your Benovit, BVC. Have you heard of Benovit before? Yes, no.
No.
No, okay, never mind. All right, so the mildest form of corticosteroids cream will be your 1% hydrocortisone. This is very mild only, so even babies can use, all right? Mild hydrocortisone, all right? Then after that, you go to the moderate strength, which is your Umovit, okay, clobetasol, butyrate, all right? Then after that, the potent one will be your Benovit, mometasone or Elomet, okay, or fluticasone propionate, okay. The important name will be your Elomet, Benovit, Umovit, things like that, alright. The super potent one will be your Dermovit, alright. Basically, is your clobetasol propionate, but in different strength lah, different from the previously clobetasol butyrate. That one is Umovit. This one is propionate. So all these different type of topical steroids potency is very important, and if you can try to remember this, alright. This slide is very important. Maybe you'll come out in your MCQ which is the most potent topical corticosteroid or which is the mildest corticosteroid. I don't know, okay? So this slide is important, alright? So when do you use corticosteroid? Very useful topical medication widely used for many inflammatory skin conditions. So the mechanism of action is anti-inflammatory or immunosuppressive. So basically you go to see doctors for any kind of skin condition, they'll give you some form of steroid cream. Okay, most commonly prescribed your Benovit any skin rash, you go to see doctor, you tell the doctor skin itchiness, skin rash, any redness. The most common medication prescribed will be your topical corticosteroids. Alright, so the local side effect and the systemic side effect of topical corticosteroid is very important. This one you must memorize. When I say memorize, you must memorize at least 5. Exam will come out, alright? So localized side effect will be quite rare. Will be your skin atrophy, striae, telangiectasia, pigmentary changes, your acne. Acne is common. Acne is more commonly seen in your systemic corticosteroid, alright? Then your perioral dermatitis, your rosacea, your secondary infection, worsening of the pre-existing infection, delay wound healing, and also hypertrichosis. So if you can, try to memorize at least 5 of the local side effects. Okay. Where is it? Sorry. Alright. So telangiectasia, these are the pictures of all these localized side effects. But actually, you can see these localized side effects in systemic corticosteroid as well. So those patients who are on high dose oral steroid or IV steroid. So in which condition do you need very high dose oral corticosteroids? So in medical, there are many conditions that you might need steroids to treat, all right? Like your nephrotic syndrome, your SLE, your hematological diseases. So all these conditions will need very, very high dose steroids. Or even for dermatology, your pemphigus vulgaris, pemphigoid, you need very, very high dose steroids. High dose means your 1 milligram per kilo. In a 60 kilo patient, you need 60 milligram of steroid. Means 60 milligram, one tablet is 5 milligram, 5 milligram prednisolone. So you need how many? You need 15 tablet, is it? 15. How many tablet do you need? See, I have to use calculator because my mathematics gone and 12 tablet. Okay. 12 times 5 is 60, correct. You have to take 12 tablets every day of the prednisolone. One tablet prednisolone is 5 milligram. Alright. So you can see all these dry acneiform eruptions or atrophy or skin thinning telangiectasia in patients who are taking high dose of systemic steroid as well. All right, more commonly seen in systemic steroid actually in your parenteral form of steroid lah. So steroid acne, you can see perioral dermatitis, steroid acne. All right. So this is very important. This one you must memorize, must memorize. So for systemic side effect of steroid, cataract, I cannot highlight. Your cataract, I cannot highlight. Okay, anyway, your cataract, glaucoma, or eye side effect,